Hey everyone, welcome to GrowMed. In this video, we will look at the questions which were asked in the recent Jan 2024 FMG. So this is the list of the important topics जिसमें से questions पूछे गए थे and what kind of questions were asked. Either there was a case or a one-liner. We will look at all those points now. So this video is to help you guys with high-yield topics which you must read for the upcoming exam. So let's look at the pharmacology important topics. So there was a question on the statin's mechanism of action. So it acts by inhibiting the enzyme Hmge CoA reductase, which is a rate limiting enzyme in the formation of the cholesterol. Okay, then moving on, there was a question on this malaria treatment, a very important topic, malaria treatment. And question is, every year question is asked on this malaria treatment. So this time there was a question on this Plasmodium vivax, and there was a pregnant lady. So how will you manage this patient? The answer was the quinine. Okay, so this is a repeat topic, malaria treatment. Then side effect of the amiodarone. There was various um, things described given in the option, like the hypothyroidism and something. So, and the question was asked the least likely, which is not, or which is the least common. So the answer was the gynecomastia. Then disulfiram like reaction. There was a case describing that an alcoholic, he took some other drug and they had asked which kind of reaction it is. Okay, so this was disulfiram like reaction. Then next question, it was asked on the bedaquiline side effect. So bedaquiline, it is an anti-tubercular drug. Okay, so this is an anti-tubercular drug and it causes Q-tip prolongation. So this was asked on ECG, what changes you can see if a person is taking bedaquiline. Then there was a question asked on this pregnant female and she was having DVT. How will you treat the patient, or which of the following drugs will you prescribe her? So we will be usually prescribing low molecular weight heparins. So as that was not given in the question, so enoxaparin was given in the option, which is the right answer. So in pregnancy, which drugs are safe and which drugs are contraindicated, it is a very important topic. As you can see here, one question asked on this, then another question was asked on this, and here also a captopril, which is contraindicated in pregnancy. So drugs and pregnancy, and the safe drugs in pregnancy, and the contraindicated drugs, it is a 5-star topic. You need to look at all the drugs and their side effects. If we take them in pregnancy, what side effects can be seen? Okay, so the next question, they had given a case, and in the last they had described um, which of the following diuretics prevents the loss of potassium, and it was amichloride. So diuretics also a very important topic. Okay, then moving on, captopril is contraindicated in pregnancy because it has a teratogenic effect. Then thiazide act on sodium chloride cotransporter. This was asked as a one-liner. The next question, apagliflozin, its mechanism of action. There was described in this question that which of the following anti-diabetic drug acts by increasing glucose loss from the urine, increase glucose loss in the urine, and the answer was the ampagliflozin. A very easy question. Okay, so anti-diabetic drug also, they are a important topic. Then amantadine filler toxicity was asked. It causes acute liver failure. Then moving on to the next question, in a child, he was having this generalized tonic-clonic seizures and he was brought in the emergency. How will you manage this patient? Usually we will be using the Valpro 8 for its management. Okay. Then bioavailability, definition was asked on this bioavailability, that it is the amount of the drug that reaches into the systemic circulation in the unchanged form. Then breast cancer drug of choice, as we all know that it is the tamoxifen. Tamoxifen is the serum and it acts as a receptor modulator. There is another very important side effect of this tamoxifen, which is the endometrial cancer. So this was asked in the past year. So tamoxifen also a repeat topic. Then moving on, ethambutol side effect. Ethambutol is an anti-tubercular drug and it causes optic neuritis. So that's why we need to use it very carefully. Then the next question, antipsychotic drugs. Antipsychotic drugs also a repeat topic. Every year there are questions on this, either on the side effects or their classification, which is the typical, which is the atypical, and this question can be asked in integrated with the psychiatry also. So the question was asked on the ziprasidone, the least common side effect of this. So it causes least weight gain among the antipsychotics, as the antipsychotics have a property of increase in the extrapyramidal side effects, and they also increase weight. But the ziprasidone, this causes, this does not cause weight gain. Okay, then moving on, drug of choice for the glaucoma, anti-glaucoma drugs, also a very important topic, and frequently questions are asked on this topic, so it is a must do topic. Okay, and a repeat question. So drug of choice for glaucoma, open angle glaucoma, it is the latanoprost, which is the PGF2 alpha agonist. Okay, so this can be asked in integrated with the ophthalmology also. Then moving on to another very important topic, the myasthenia gravis. माइस्थीनिया ग्रेविस के बिना FMG का पेपर बन ही नहीं सकता, ठीक है. तो इट इज़ दैट इम्पॉर्टेंट कि माइस्थीनिया ग्रेविस का एक केस तो, एक क्वेश्चन तो हर साल ही आता है. एंड देयर वाज द क्वेश्चन ऑन दिस ड्रग ऑफ चॉइस, which is the pyridostigmine. Then the last question from the pharmacology, a long case kind of a question, that a patient was on antiretroviral therapy and he was also on the anti-tubercular therapy. So they had described few drugs in the options, and they had asked you which of the following dose adjustment is required for the patient. Okay, so the anti-tubercular drugs and the antiretroviral therapy, this is also an important topic. Okay, so this was a list of the important questions and the topics which are asked in this year, Jan 24. Okay, so I hope this video will help you with your preparations for the upcoming July FMGE. So this is not the exact recall video कि सारा पूरा क्वेश्चन के साथ में पूरा आंसर, ठीक है. इट वॉज जस्ट अ वीडियो ऑन द टॉपिक्स टू गिव यू एन आइडिया कि आपको किस टॉपिक पे ज़्यादा फोकस करना चाहिए और किस टॉपिक से रिपीट हुए हैं क्वेश्चंस और किस टॉपिक पे फ्यूचर में क्वेश्चंस पूछे जा सकते हैं. ओके, सो दिस विल हेल्प यू इन योर प्रिपरेशन, ठीक है. सो थैंक यू सो मच गाइस फॉर वॉचिंग दिस वीडियो. लाइक द वीडियो, एंड इफ यू फाइंड दिस कंटेंट यूजफुल, शेयर इट विथ योर फ्रेंड्स, एंड ऑल्सो सब्सक्राइब टू ग्रोमेट. थैंक यू सो मच. बाय बाय.